Welcome back to this next video in which we are discussing heart failure. So at the moment we're discussing cardiomyopathy, and as I have said at multiple points in previous parts, one of the main things that I want to communicate to you in this video is the fact that heart failure does not mean cardiomyopathy necessarily. They are not synonymous with one another. So this was a major misunderstanding that I had for a huge amount of time, that I used to think when people wrote heart failure in someone's past medical history, that that meant that that individual had cardiomyopathy, that they had an issue with the actual muscle that makes up the walls of the heart, the actual contractile muscle, that there was some sort of issue with that. However, that is not necessarily the case. Remember, heart failure literally means failure of the heart to do its job, failure of the heart to pump blood around the circulation, failure of it to maintain a good enough flow, a good enough cardiac output. Whereas cardiomyopathy means that there is something wrong with the actual heart muscle itself. And even though cardiomyopathy is a cause of heart failure, a very important cause of heart failure to know, and indeed a permanent cause of heart failure, if you have cardiomyopathy, it's never going to get better, not without a heart transplant. We cannot fix this at present. Maybe we will be able to fix it in the future, but at present we cannot fix it. So at present, if you've got cardiomyopathy, you have permanent heart failure. However, there are other causes of heart failure that may well be reversible, and the individual may not yet have cardiomyopathy. As we've seen so far, and I am just going to go over what we've already said about cardiomyopathy, many of the things that I've already talked about as causes of heart failure, so hypertension and valvulopathies, they will lead to cardiomyopathy as well, and that will make the whole situation worse, because then you've got two causes of the heart failure, the actual primary issue and then the secondary cardiomyopathy as well. It is not necessarily the case that they will have led to cardiomyopathy at the time of diagnosis, and therefore if you can reverse that cause before it leads to cardiomyopathy, you may be able to completely cure the heart failure. So heart failure isn't necessarily permanent, whereas cardiomyopathy is without a heart transplant. So what have we already said about cardiomyopathy? We've said that the classification is very crude at present. It's not based on histology or pathology, it's based on simple anatomy. So either the wall muscle can become hypertrophic, where it becomes massively thickened, and remember, it's not an increase in number of cells, it's an increase in the size of all the cells, so all the individual cells have hypertrophy to produce this, and we talked about how this really only ever affects the left ventricular wall muscle or the right ventricular wall muscle, causing left ventricular hypertrophy and right ventricular hypertrophy respectively. And the reason this will lead to heart failure is the lack of space inside the actual chamber. So there just isn't enough blood in the chamber to actually produce a meaningful cardiac output when it contracts anymore. So even though it's massively muscular and strong, it's got no blood to actually push. Or the other option is dilated cardiomyopathy, where the wall becomes hugely dilated, so the chamber size becomes much bigger and the wall becomes much thinner, and this leads to heart failure, because even though there's a huge amount of blood now to actually be pumped, it's just too weak to actually produce meaningful cardiac output, and that can affect all four chambers of the heart, although it's really only going to lead to significant drops in cardiac output if it affects the left ventricle or the right ventricle. Dilation of the left atrium and the right atrium is, however, very common, but really it's more sort of a clue for you to think, why has that occurred, and then try and figure out what's caused it, because that whatever has caused it is probably causing heart failure. But the actual cardiomyopathy of these two chambers itself will not be leading to the heart failure. So we then started talking about causes of cardiomyopathy, both hypertrophic and dilated. We started by discussing ischemic heart disease, which is the most common cause of cardiomyopathy, and we talked about how this can cause cardiomyopathy in two ways. It usually leads to a dilated cardiomyopathy. Either you can have acute MIs where you lose a huge number of heart muscle cells all in one go, and that's going to massively weaken the whichever chamber it affects, and of course it's only going to lead to heart failure if it affects the left ventricle or the right ventricle, and you'll get a massive sudden drop in cardiac output, so a massive acute onset of heart failure if that's the case. We also talked about how you can get ischemic cardiomyopathy just on a gradual basis, where you've got chronic ischemia and you get gradual loss of heart cells over the years from that chronic ischemia, and that again will lead to a dilated cardiomyopathy. It's just a different time course. This will lead to it bang, whereas this gradual ischemia will take years and years for it to lead to ischemic cardiomyopathy. We then discussed hypertension as a cause of cardiomyopathy. This is called hypertensive heart disease. So systemic hypertension for years and years and years can lead to a hypertrophic cardiomyopathy of the left ventricle. We also discussed the fact that pulmonary hypertension can lead to a hypertrophic cardiomyopathy of the right ventricle. And in fact, I've got a little extra nugget of information to add on here. If you get right ventricular hypertrophy as a result of pulmonary hypertension that has been caused by lung disease, there is a special name for that. That is called Cor Pulmonale. So this is right ventricular hypertrophy secondary to lung disease. And I'll just abbreviate, where's the back? Lung disease, I'll abbreviate disease down to DZ. So if you've got COPD or interstitial lung disease, we've discussed that this can lead to loss of capillaries within the lung tissue. That can then lead to pulmonary hypertension. That pulmonary hypertension, we have discussed how that can lead to right heart failure. However, it can also lead to hypertrophic cardiomyopathy of the right ventricle over time. So you're going to have heart failure not only from the pulmonary hypertension itself, but then also from the right ventricular hypertrophic cardiomyopathy. If that hypertrophy has occurred, that disease process is called Cor Pulmonale. People often misuse this term. They use it as to mean right ventricular or right heart failure as a result of lung disease. That's not strictly what Cor Pulmonale means. It means more than that. It means right ventricular hypertrophy secondary to lung disease. There's another one of my previous misunderstandings. I used to think Cor Pulmonale was just the name for right heart failure secondary to lung disease. It's not. It actually means more than that. It means right ventricular hypertrophy secondary to lung disease. So an additional nugget of information there. Finally, we then discussed valvulopathies. So again, valvulopathies can cause heart failure of themselves, but they can then also add to the heart failure by then leading to cardiomyopathy. And we've discussed how they can either lead to hypertrophic cardiomyopathy or dilated cardiomyopathy. It's a little bit harder to say which it will lead to. So the reasoning here is aortic stenosis, let's take as an example, that's going to chronically strain the left ventricle, and you can imagine that that might lead to a hypertrophic cardiomyopathy of that left ventricle. So then you'll have heart failure not only from the aortic stenosis, but also from the hypertrophic cardiomyopathy of the left ventricle. We discussed how, for instance, mitral stenosis will lead to left atrial dilated cardiomyopathy, and that's an example of why it's important to acknowledge when you've got atrial dilated cardiomyopathy, because it is cluing you on to the fact that there is something wrong that is causing that. And in fact, you will see that the dilation of the atria is often a very good indicator of heart failure, of left heart failure if you've got left atrial dilatation, and either right heart failure or indeed left heart failure if you've got right atrial dilatation. So let me just discuss this in more detail. So any cause of left heart failure, all of the things that we've discussed, so remember, left heart failure just means heart failure due to pathology on the left. All of that is going to lead to, we've discussed, blood backing up into the pulmonary system. So remember, initially, you can imagine that when the left side is not pumping out enough blood, initially the right side will still be pumping out lots of blood, and we've discussed how that leads to blood backing up in the pulmonary system. So we've discussed how it leads to pulmonary venous hypertension, capillary hypertension, and pulmonary arterial hypertension, and that pulmonary arterial hypertension is then going to lead to the right ventricle calming down as well. So the right ventricle no longer pumping pumping a lower amount of blood, so reduced cardiac output on the right too, and then the flow rate is equal and everything's back in equilibrium. but that only happens once you've got the hypertension in the pulmonary system. Now, what we didn't discuss is that not only are you going to have pulmonary venous hypertension, but of course you're going to have too high pressure in that left atrium from this backing up. And that is going to, be pushing out on the walls of the left atrium chronically. So you're going to have high pressure in this system pushing out on those walls, and that will gradually lead to dilation of the left atrium. So left atrial dilatation is really just a way of saying that that person's almost certainly got something causing left heart failure. So that's why it's a very, very useful clue on CT or on echo that there's something wrong when you see a massive great left atrium. Right atrial dilatation can also occur if the pressure is too high in the right atrium. Now, what might cause that? Well, either right heart failure or left heart failure, because as we've discussed, if you've got left heart failure, you're going to get pulmonary hypertension from that, and that's then going to mean that the right ventricle can't pump enough blood, so you can then actually get blood going back into the right atrium. So this requires a bit more of an explanation. So when you've got the right ventricle struggling to pump against the high pressure in the pulmonary arterial system, what you can then actually get is accelerated degeneration of the tricuspid valve. You can get tricuspid valve disease because, of course, the right ventricle's pumping really hard. It can't go up here, so it's pressing against this, and that can actually damage the tricuspid valve. It can lead to degeneration and then tricuspid regurgitation. So often, when you're either right heart failure or left heart failure, which of course is going to lead to the right ventricle not being able to pump blood into the pulmonary system, these can lead to then tricuspid regurgitation occurring. Blood is then going back into the right atrium, which causes too high pressures in the right atrium, which can then lead to right atrial dilatation, RAD, I'll just abbreviate that too. And actually, as we'll see later, more can happen. The blood can then regurgitate up the superior vena cava and down the inferior vena cava. And then when it goes down the inferior vena cava, one of the first things it hits is a massive great organ here called the liver. So just below the diaphragm is the liver. The inferior vena cava goes through the liver, and you've got the hepatic veins coming off or feeding into the inferior vena cava. So if you get blood squirting back down the inferior vena cava, it can squirt down the hepatic veins and damage the liver. And that's a process called congestive... Oh, I'm not writing it very well down there. Sorry, there's not enough space down there. That's a process called congestive hepatopathy, and we're going to discuss this later on, right at the end, when we discuss horrible consequences from heart failure. So again, I just want to stress that left tricuspid regurgitation, right atrial dilatation, and congestive hepatopathy, they can either occur from right heart failure or indeed from left heart failure, because that backs everything up to affect the right side of the heart. Right, so all of that was in aid of saying that left atrial dilatation and right atrial dilatation are significant. You don't ignore them. Even though they themselves are not responsible for the fall in cardiac output, they do mean that there is something wrong if they've happened. Left atrial dilatation will only occur in left heart failure, but right atrial dilatation can occur in left heart failure or right heart failure. Onwards, I do have some more bits of information to talk about with regards to cardiomyopathy, and that is that there are a few other causes of cardiomyopathy. So the three that I want to add on, and I'm going to write them all in one go. So there is something called tachycardia-induced cardiomyopathy. So if your heart is going too fast for a very long time, this can lead to problems with the heart muscle. And again, this is one where I can't specifically say whether it's going to lead to hypertrophic or dilated cardiomyopathy. It can lead to either, but it can lead to diseases of the heart muscle. And of course, tachycardia means the heart going too fast, and it's going to affect all of the chambers of the heart because they're all beating at the same rate. So the main tachycardia, well, there's lots of different things that can cause tachycardia. We're not going to go into them in detail, but sinus tachycardia, which I'll just abbreviate to ST, one of the main causes of that is an overactive thyroid, so I'll just write hyper T4 for too high thyroxine levels. T4 is just an abbreviation for thyroxine. So if you've got an overactive thyroid, a thyroid that is secreting too much thyroxine, or if you've got hypothyroidism, so an underactive thyroid, and you're over-medicated on levothyroxine, that can cause you to have too high thyroxine levels. This can lead to the heart beating too fast in a sinus rhythm, so a normal rhythm, but beating far too fast because of the too high levothyroxine. And if that occurs for a too long period of time, the heart doesn't like beating too fast. It's not good for it at all. It can lead to damage to the heart muscle. That is called tachycardia-induced cardiomyopathy. Alternatively, if you have some sort of arrhythmia, and we're going to discuss this in the next video when we discuss arrhythmias as causes of heart failure, the main one of which, by far the most common one, is atrial fibrillation, which I'll just abbreviate to AF, and we'll discuss AF in the next video. So if you've got some sort of arrhythmia that is causing the heart to beat too fast, and that arrhythmia is not medically controlled, that again can lead to cardiomyopathy over time. So I'll discuss this more in the next video, but be aware that if your heart is beating abnormally fast for too long, that it can lead to cardiomyopathy of all four chambers. It's not really, it can lead to either dilated or hypertrophic cardiomyopathy, but it can lead to cardiomyopathy. Next, drug-induced cardiomyopathy, and these are more fine print. The main three causes of cardiomyopathy are the first three that we discussed: ischemic cardiomyopathy, hypertensive heart disease, and valvulopathies. So drug-induced cardiomyopathy, I just want to add on to this list as well. The oncologists and the hematologists can prescribe horrific poisons to treat cancer, and sometimes it works phenomenally well, other times it doesn't beat the cancer. The problem with these poisons is that they can damage the rest of the body, and there are certain drugs that can absolutely poison the heart, and these drugs we call cardiotoxic drugs. One of the main examples is a chemotherapeutic agent called doxorubicin. Now, do not ask me what this is used to treat. I do not know. I'm not an oncologist. But this is a oncology drug that is sometimes used. I think it's mainly used actually in hematology rather than in solid tumours. I think it's used for hematological malignancies. But it is a horrible drug. It is truly a poison. It's a cytotoxic poison, and unfortunately it is poisonous to the cells of the heart. So when this drug is given, you cross your fingers and hope you're going to get away with it. However, you don't always get away with it. Some people, it massively kills huge numbers of cells within their heart, and it precipitates a cardiomyopathy, and that is usually a dilated cardiomyopathy. So usually all the cells, a huge number of cells die, you lose them all, and you then end up with a dilated cardiomyopathy, and it can occur very quickly. You can be given one dose of the drug and then develop dilated cardiomyopathy in a matter of days following the administration of that poison. So be aware of that. There are horrific drugs used in oncology, and doxorubicin, I'm afraid to say, is not the only one. It's one of the famous examples, but there are others as well that are incredibly cardiotoxic and which can precipitate drug-induced dilated cardiomyopathy. And the final thing that I want to say, which I'm not going to say much about because I know absolutely nothing about it, is genetic cardiomyopathies. And in fact, I will add one final thing as well. Infection as well can cause cardiomyopathy. And I'm not going to say much about these two topics. So infection of the heart is, or infection of the heart muscle is, and I'll just move it down so I can actually write. Infection of the heart muscle is something called myocarditis. It is phenomenally rare, but it can occur. There are certain viruses that you can catch that usually would not cause you much harm. They might just cause, an upper respiratory tract infection, more commonly just called a cold. But sometimes, if you're very, very unlucky, these viruses can actually get into your blood, and even worse, they can go to your heart, and they might actually infect that heart muscle, and that's called myocarditis. It's phenomenally rare for this to happen, but it can happen. And obviously, infection in the heart is not good. It can lead to death of heart cells and therefore can lead to dilated cardiomyopathy. This is small print. I think I've seen one case of myocarditis in my entire time of being a clinical medical student and being an actual doctor. And they were in an ITU unit. They were very, very sick. But be aware of it. It can cause a dilated cardiomyopathy, but it's rare. Genetic cardiomyopathies, some people have mutations in proteins that are really important in the heart cells, and when you have these mutations, it leads to you developing a gradual cardiomyopathy. I do not know much about this. I have never actually met anyone with a genetic cardiomyopathy. I think it is mainly a topic in pediatrics, because I'm sad to say I think that unless they get heart transplant, their prognosis is not good. And I work in adult medicine looking after 70, 80, 90-year-olds. I don't think people with genetic cardiomyopathies make it to those sort of ages. So I've never met anyone with a genetic cardiomyopathy, but I am aware of it as a topic that some people develop cardiomyopathy for genetic reasons. So I'm going to add that onto that list there. So here we are, 7 causes then of cardiomyopathy. The main 3 are those top 3. Ischemic cardiomyopathy, hypertensive cardiomyopathy, and valvular cardiomyopathy. The other four are finer print, but we will come back to this tachycardia-induced cardiomyopathy because this is the reason that it's so important to rate control people with atrial fibrillation and so important to treat people with hyperthyroidism, because you do not want it triggering tachycardia-induced cardiomyopathy, and because once they've got that, they've got permanent heart failure. So thank you. We will continue our discussion in the next video by discussing arrhythmias as causes of heart failure in themselves, not by causing tachycardia-induced cardiomyopathy, just by the arrhythmia itself precipitating failure of the heart.